So we want to make sure that we prioritize all these people that are waiting to get to a family doctor. Make sure that they have access to a family doctor. Make sure that they don't have to go to emergency rooms in order to get to receive their services. We also have a lot of people waiting for surgeries, and we need to use the private sector parallel to the public sector. The Quebecers would not have to pay for anything additional, but just to make sure that those 150,000 people that are waiting right now can get treated. And one element that is critical is we have to care for our people, the people that are sick, but also the people in the healthcare system, the healthcare professionals. And for those people, we have to stop using the temps supplémentaire, the fact that they have to work overtime on a mandatory basis. We have to stop this and make sure that we have ratios of patient to professional healthcare people, that it is adequate and reasonable. And we can do this. We can do this if we have the willingness to really focus on labor shortage, to really focus on the people, to really focus on the first line.
This is a critically important question. Right now, there are 650,000 Montrealers who do not have access to a family doctor, over 1.3 million Quebecers as well. For us, the primary concern is that the current CAC administration is providing permits to doctors to primarily work in the regions and not in Montreal. In Montreal, about 68% of Montrealers have access to a family doctor. In the regions, some regions have up to 95%. So we need to abolish this PREM program to ensure that we equitably distribute doctors throughout. We also need more doctors into the workforce. So in other words, med schools have to open their doors, admit more students to ensure that we increase the pool of doctors. As well, international workers and immigrants have to accelerate the recognition of these degrees so they can actually come and work as nurses as well as doctors, and certainly there needs to be a vetting process to ensure that they have the requirements, and as well the long-term care homes. Our seniors were left to the wayside during the pandemic. We have to ensure that we have the proper ventilation system and we get the nurses and doctors to be able to support them. During the pandemic, the Army actually had to intervene, which was highly problematic. And also for us, from a structural perspective, we have to depoliticize the healthcare sector. What that means is very, very simple, is that right now the National Health Director was really embedded with the National Assembly. We need to ensure that it's apolitical, so that if there is a lockdown or any kind of health measure that's put into place, it's done based on the science, based on the data, and not based on any political will. And last but not least, because of the pandemic, there has certainly been a backlog in surgeries because, as you know, we've all been taking care of people who had COVID. There's 160,000 people waiting for the backlog in surgery. So that's another consequence of the shortage of doctors. We need to expand our healthcare system. And we are for analyzing the possibility of having some area of privatization of our healthcare system that's going to incentivize competition and innovation. Right now, we're dumping money into this public system that is ineffective and inefficient. We would still maintain it, but we still need to have one way, shape, or form, and this is going to be analyzed by experts. A fraction of it needs to be privatized, in our view, similar to the Dutch model that we have been speaking about more at length on our platform. And I think that overall, that is our general framework of how we see a first step into solving the healthcare crisis.
The Conservative Party of Quebec is proposing mainly three things. First off, we want to decentralize. We think there's way too many bureaucrats and it's way too centralized. We want to bring the managers closer to the patients and downsize the structure. The second thing we want to do is we want to install more competition between health institutions. To do that, we want the money to follow the patient. Like currently they have fixed envelopes, and we do believe that the hospital should have a benefit or an interest to attract more patients, not to do the opposite. And the less patients they have, the more money they're making. There's something wrong with the funding of our healthcare system right now. We've studied all the European models that work much better than ours, and they all have a system more or less where the money's following the patient. The third thing we want to do is to open up the door for the addition of the private sector. We think it's being done with the public insurance. Obviously, we don't want to review the Canada Health Act, but we want to make sure that if the public monopoly is not able to provide you the services that you deserve in a reasonable time, then you can cross over and go to a private facility, and the public insurance should pay for it. Just like it works in Sweden or in Germany or in many other European countries that we've studied a lot. The idea also is that if ever the private sector is able to do the same kind of surgery or any treatment for a lower cost, you don't even have to wait for a reasonable delay. You can go directly to the private sector, and the state is saving money that way. We also want to add physicians. There's two ways we want to do it. First off, by recognizing physicians who are here, who are immigrating, and who are unfortunately victim of corporatism. We think it's time to end it. We're not saying that we want to give the right to practice to everybody who comes from anywhere. But, if they have they're passing a test, and if we can bonify that, if there's a shortage somewhere we can add, we should do it, but we shouldn't be closed-minded like we've been for too long. But in the long run, we also want to, because you can't train physicians very quickly, we would like to add 2,000 physicians, because we looked at all the models. They all have more physicians than we do here in Quebec, and our population is aging, so obviously we're going to have a huge shortage if we keep going the way we are.
What we need is to work from what is actually working right now inside our system and build from what is working. That means bringing back the people inside the system by giving them better working conditions. That's the essential condition for every promise in healthcare to work. We also need to see what works in the system. The CLSCs are a system that has the potential to work. We need to reinvest in them. We need to make them the first door to get into the healthcare system in Quebec. We also need to work based on the 811 line. It is a system that Quebecers know. It's a system that works. We need to connect it to the healthcare system and transform it into a real triage system at home, because that's the main thing Quebecers want. They're tired of being disoriented when it comes to healthcare. They want to know by which door to enter in the system. Some of them have a family doctor, some of them don't have a family doctor, but even if they have a family doctor, it doesn't mean their doctor can see them on a Thursday night if their daughter has a problem in her ear, We need a fast and easy way to know by which door we can enter the system. We think the 811 is a system that should be reinvested in and better exploited to really do that work of orienting people from home to the best place in the healthcare system to enter. So it's not a very shining program in terms of healthcare at Québec Solidaire. It's a very humble and simple one, because we think Quebecers are tired of those shining promises that never happen and of parties that never deliver.
Yeah, and we have numerous policies coming forward to that. I think the big ones that is a sort of theme of our campaign is, abolishing 96 and 21 and 40, particularly 96 and 21 are going to have detrimental effects on the healthcare system. I think that's sort of, it just creates this glass ceiling above the heads of all Quebecers, particularly minority and English-speaking Quebecers, on the access to services they can have and the ability to work in the public service as well. Obviously you guys are all very well informed of it, but of the eligibility certificates, right, to be English eligible to get basic health and social services, that will be detrimental over time to the viability of our institutions, right? So for the third to 40% of people have access to it, from the 1.2 million down to 300,000 or 400,000 or so that might have access under the eligibility certificates, it will collapse those institutions over time. However that looks, we're seeing the implementation of 96 over the next few years. We're not sure exactly how that looks, but certainly looks dire the way that it will be implemented by a CAC government, or the Liberals or other parties who would keep it if they were in power. Secondly, we do, we're very proud of another marquee policy that's unique to the Canadian Party, is our English Language Services Act, and that would be a minister ombudsman and commissioner to ensure English language services are implemented provincially and municipally across the province, right, with explicit guarantees for basic services, particularly in health and social services. So we're very proud of that policy. And then thirdly as well, we do have a healthcare policy that directly relates to Anglophones. One thing that has been, I think, underreported is the creeping privatization of healthcare, particularly during the pandemic. It's gone from about $300 million in 2019-2020 to about $800 million spent on private healthcare in this province. So, and there's not the same guarantees. If you look at the way the law is written, the Health and Social Services Act and all the regulations, it doesn't actually apply to the vast majority of these private contracts that are actually struck with other actors. So this sort of privatization of basically the entirety of our healthcare system over time is really problematic for English speakers, and I think that's not really on the public agenda and something that we've been talking about at the Canadian Party. And so those are sort of the big ones that we've been talking about, right? Knock down the artificial impediments in identity and language, English Language Services Act for explicit guarantees. Let's stop the privatization where there is no guarantees for the English-speaking community.